everyone, my name is Kanapia Bachihana and I'm here to demonstrate you the Glasgow Coma Scale or GCS. So GCS is a summation of a process for eye, verbal, and motor response. The score is determined by the sum of the score in each of the three categories that a maximum score of 15 which indicates a full awake patient and a minimum score of 3 which indicates deep coma or brain dead state patient. The purpose is used to describe the general level of consciousness in patient with traumatic brain injury or TBI and to define brain categories of head injuries. The first procedure is perform hygiene. The rationale is to prevent spread of microorganisms. The next is initially observe if the patient is opening their eyes. Next procedure is if the patient is opening their eyes, you assessment is complete, score 4 points. You should then move on to assessing verbal response. Next procedure is let's see, Miss Pinagayaw. Okay. So if the patient is not opening their eyes spontaneously, you need to work through the following steps until a response is obtained. You need to speak to patient. Miss Pinagayaw. If the patient is opening their eyes in response to the sound of your voice, score 3 points and you will be moved on to the assessing verbal communication. Miss Pinagayaw. So, if the patient doesn't open their eyes in response to the sound, you need to move on to assessing applying pain. Assessing eye open to pain. Example, applying pressure on the nail blades of the finger for 10 seconds. Miss Pinagayaw. If the patient opened their eyes in response, pressure on the nail bed of the finger, score 2 points and you should move on to the assessing verbal response. Miss Pinagayaw. If the patient does not open their eyes to a painful stimulus, score 1 point and you would then move on to assessing verbal response. If the patient cannot open their eyes for some reason, example, iodoma, trauma, dressing, you should document that eye response could not be assessed or empty. You would move to assessing verbal response. Next procedure is initially try to engage the patient in conversation and assess if they are oriented. Some common question you can ask to help assess this might include, can you tell me your name? Do you know where you are at the moment, and do you know what the date is today? Ma'am, pwede niyo po ba sabihin ano pong pangalan niyo?
Honey po.
Honey. So, alam niyo po ba kung saan kayo ngayon?
Hospital.
Alam niyo po ba kung anong date ngayon?
February 5.
So, if the patient is able to answer your question appropriately, the assessment of verbal response is complete. Score 5 points, then move on to the assessing motor response. Ma'am, pwede niyo po bang sabihin sa akin ano pong pangalan niyo?
Mango.
Alam niyo po ba kung saan po kayo ngayon?
CR.
Alam niyo po ba kung anong date ngayon?
December 10.
So if the patient is able to answer but their response didn't seem quite right, example, they don't know where they are or what is the date is, this would be classed as confused conversation. So score 4 points, then move on to assessing motor response. Ma'am, pwede niyo po ba sabihin sa akin ang pangalan niyo? Ano pong pangalan niyo, ma'am?
Go.
Alam niyo po ba kung nasan kayo ngayon?
Korea.
Alam niyo po ba kung anong date ngayon?
K-pop.
So, if the patient responds with seemingly random words that they are completely unrelated to the question, you should ask this would be classified as the inappropriate words. So, score 3 points, then move on to assessing motor response. Ma'am, ano pong pangalan niyo, ma'am? Pwede niyo po bang sabihin sa akin? Alam niyo po ba kung saan kayo ngayon? Alam niyo po ba kung anong date ngayon? So if the patient is making sound rather than speaking words, example groans, then this will be classified incomprehensible sounds. So score 2 points, and you would be then moved to assessing the motor response. Ma'am, ano pong pangalan niyo, ma'am? Alam niyo po ba kung saan kayo ngayon? Alam niyo po ba kung anong date ngayon? So, if the patient has no response to your question, score 1 point, then you will be moved on to assessing motor response. If the patient is intubated or with tracheostomy or has other factors interfering with their ability to communicate verbally, their response cannot be tested, and for this you would write NT. You would then move on to the assessing of motor response. So the next is ask the patient to perform a two-part part request. Example, lift your right arm off the bed and make a fist. So if the patient able to follow this command correctly, score 6 points and the assessment would be over. Ma'am Pinagayaw, pakitaas daw po ng kamay niyo, ma'am. Yung paa niyo, ma'am, kaya niyo po, dalawa po. Kaya niyo po mag-make a fist, yung ganito po. So, that is 6 points. Next is, ma'am, pakitaas po ng kamay niyo. Yung paa niyo po, kaya niyo po mag-make a fist. So if the patient does not obey the command, apply painful stimuli if the patient makes attempt, reach toward the site at which you are applying painful stimulus. Example, head and the neck. Then brings their hands to their clavicle, and this will be classed as localizing to a pain score. So score 5 points and the assessment will be over. Ma'am Pinagayaw. If you applied stimuli, and the patient tries to withdraw from the pain, example, the patient tries to pull away their arm away from you, when you applying a painful stimulus to this fingertip, so score 4 points and the assessment will be over. Ma'am Pinagayaw. If you applied painful stimuli and the patient responds with an abnormal flexion, score 3 points and the assessment will be over. Ma'am Pinagayaw. If you applied a painful stimuli and the patient responds within abnormal extension, score 2 points and the assessment will be over. Ma'am Pinagayaw. If you applied a painful stimulus and the patient has no response, then score 1 point and then move to assessment, and then assessment will be over. Ma'am Pinagayaw. So, if the patient is unable to provide a motor response, example of this is paralysis. This should be documented as not testable, lastable, or anything. Once you have assessed eye opening, verbal and motor response, you would add together to together to you would add together you add scores together to calculate the patient GCS. The GCS should be documented showing score for each individual behavior tested. And that's for the GCS or uh, GLOMO. That's for the GCS.